Hello everyone and welcome to OPG Hub. My name is Joshua. I'm so excited to see you. I hope you are doing wonderfully well. Okay, so in today's video we are going to have the opportunity to go in and out of the court, also just to stroll around the hospital, and I know you are going to enjoy every bit of it. So guys, kindly stay true to the end of the video. Let's dive into it. Story. I know you say time. So once upon a time. Okay, so there was this young lady called Obapaya. She's about the age of 38 years. She's a very beautiful lady, of course. So one day she decided to go to a party with her friends to have some good time. And then during the party, she actually was binging, taking some food and drink and that stuff. And then she noticed she had a severe abdominal pain. So, she did not really take much concern to that pain until after the party when she drove back home. Early in the morning, she could not bear the pain, so she decided to go to the hospital, just a few hour drive from her house. And then when Obapaya reached the facility, she felt disrespected. Why? Because she went early in the morning and joined the queue. But then she noticed that at the OPD, there was a particular attendant there who was more like doing favoritism to the people she knows. So even though those people came quite late and joined the queue, he rather called them out to serve them. So she felt so disrespected that why will I join a queue for someone who has just arrived to just pass the queue and to be treated? Fast forward, she had an opportunity to meet the doctor. And then on meeting the doctor, she requested to know the name of the doctor, but the doctor was like, well, never mind, my name is not so important to you. What is important is your condition that you have come for it to be treated. So, as usual, I've come to my doctor, so my doctor should do something for me. Then the doctor gave him some medications and other stuff. She felt better. But then she asked the doctor, doctor, please, what are some of the complications or some of the side effects that is related to these medications you have given me? The doctor was like, madam, stop asking me a lot of questions and just obey what I'm saying. We are the medical doctors and we know what is best for you. So the lady felt so disappointed, especially in the way the doctor reacted towards her. Let's continue the story. So that day, the lady was discharged and when she went back home, with the trust of the medications, she started taking them. She did not know the number of those she was supposed to take. She didn't know durations. So she just took them anyhow. Later in the evening, she had severe headache and she knew it was because of the medications she took. So she quickly rushed back to the hospital. Upon arrival to the hospital, she had the opportunity to meet one of the health facility personnel. And so she was like, oh no, these are the medications they gave me and I'm having severe headaches and other stuff. And so I want to know my diagnosis and I also want to have a view on my medical records. Then the person he met was like, no. In this facility, we don't give medical records to people. And we also don't tell patients their conditions or their diagnosis. So, I cannot address your concerns to the authorities. She felt so bad and decided to call her lawyer. So she called her lawyer and then went to the court. So let's see what happened at the court. Let's go into it. Court rise. Case number 419, the state versus Obapaya. After a deep, thorough investigation and fact-finding in regards to the claims presented by our plaintiff, Obapaya, the court in the interest of justice rules that all patients have rights, including Obapaya. The verdict is binding. The case is now closed. Court is adjourned. Go and sin no more. And so, do you know that as patients, you actually have rights designed to protect you anytime you walk in and out of the doors of the hospital? Yes, you actually do. So in today's video, I'm going to show you a simple mnemonic that will help you know the rights that you have. And you knowing the right that you have actually will help better your health experience. So the mnemonic is respect. RESPECT. Let's begin. R. You have the right to be respected. Now, you have the right to be respected again, and I repeat, you have the right to be respected. You need to be treated with dignity, courtesy, and no discrimination, regardless of your religious background, your age, your sex, your socioeconomic status, etc. Now, what respect does is that it builds trust between you and your health worker. Also, respect builds a positive environment, and the ultimate goal is for you to have a better health outcome. So it is very important, you need to be respected, and that is your right. The next is E. Right to explanation of treatment and procedure. This ensures that you as a patient are fully informed about your treatment and procedures. Now, it's the duty of the healthcare provider to explain to you the treatment and the procedures that you receive. Whether it's an invasive or non-invasive procedure, you need to be informed. Now, the healthcare provider needs to explain to you in simple terms for you to understand, void of complex medical jargons. Also, you as a patient need to ask those questions, and you receive the answers and the answers and the answers. Until you are fully cleared, don't stop asking questions. Also, the healthcare provider needs to let you know the benefits, the risks, and the side effects of the treatment and the procedures that you may receive. However, in the case of emergency, they will not have the time to explain to you the benefits and the risks of the emergency procedures they will give, so they can go ahead to do it. Then again, they need to also inform you about other alternates to healthcare in terms of your treatment or procedures for the overall betterment of your health. I hope you got it. So anytime you get to the hospital, ensure that they explain each procedure and treatment you receive. The next is S. You have the right to safety during healthcare. Now, it's very important that even as you are going for treatment, your safety is also very important. And so the hospital needs to ensure that you and your well-being is safe and the environment is devoid of potential hazards. So this is what they do. They need to ensure that one, they have you being treated with qualified health professionals. Two, the hospital environment or the healthcare environment needs to be well kept in as much as to avoid what we call nosocomial infections, that's hospital-acquired infections. Also, the hospital needs to ensure that the equipment that they use in caring for you is in a good shape, the tools they are using are sterile and devoid of infections. Also, it is required that the hospital needs to take care of your safety and reasonably your personal properties that you brought to the facility within the confines of the facility. They need to ensure they are safe. Okay. The next is P. Right to privacy of personal and medical information. Now, this is very important because you as a patient, you have the right to enjoy that your medical information or personal information you shared with the doctor or the healthcare professional remains confidential. And I'm sure most of the doctors are good at it. In fact, qualified health professionals will keep your information very, very confidential. But in a case where of a public interest and the law demands it, the doctor will share it to them, okay, to the law or whatever it may be. But then as long as it stands, your informations are very confidential, devoid of a third party involvement. Until you give the consent for them to share the information, they will not share the information. Now, you also have access to your medical records as well. It's your property and you have access to it. Like the case we saw, the woman did not have access to her medical records and did not know the diagnosis she was having, but you should have it. It's your right to enjoy it. It is also very important that it's your right to know the name of anyone that comes to play a part in your health journey. That is, if anyone comes to you, you need to know the name of the person and the role. Example, my name is Joshua, a medical student. Or example, madam, my name is Joshua, a consultant nephrologist. I'm here to see you, so and so. These are what they need to do. So if they don't have a name on them, maybe a name tag or stuff, you have the right to ask them, please, what's your name and what's the role you are playing in my health journey? So you have the right, your informations and your personal information or medical information to be confidential in the healthcare. The next is E. You have the right to engage in decision making in your health journey. Now, this is very important because you need to play active role in your health journey. You need to play a major role in terms of making decisions. Example, assuming for your religious beliefs you don't take blood or you don't receive blood donations, you have to make that decision that no, doctor, I'm not supposed to receive blood because of my religious belief, and I need it to be in alignment with my preference and beliefs, so don't give me blood. The doctor has to respect that and give you another alternate instead of giving you the blood. Do you get it? Do you agree? So that's very important for you to know. Also, you can also make a decision that I want so and so, this is my family member, to take this decision in the case where I cannot take those decisions. And the doctors or the health professional needs to respect you for that. So in all, you have the right to take part in the decision making. So you can say yes or you can say no, and no one can threaten you for that. So the next is C. You have the right to consent. Now, so if you remember, I said the E, that was the right for explanation of treatment and procedures. Likewise, in the C, you have the right to consent. Now, it's very important for you to know that the emphasis is being made on you voluntarily agreeing to either receive the treatment or the procedure. You have the final say in your healthcare journey. When you say no, it is no. When you say yes, it is yes. As long as you are in a state of a good mind, you are not intoxicated or you are not influenced by any drug, what you say is very important to the healthcare professional. But in cases of emergency, where they are supposed to do emergency procedures to you, your consent really does not really matters. Example, let's say, assuming you have a road traffic accident and you have a rupture of your lungs, and then air started entering your lungs, and then it's inflated in such a way that it's now compressing on your heart. This is an emergency procedure they need to do to save your life. So they will not ask you, do you agree or not? No, they'll just go straight ahead to save your life. I hope you get it. So you have the right to consent to any treatment or procedure. So the last one, which is T, you have the right to receive transparency with your cost. Now, it's very important at this point because many a times some facilities will rather want to add some little pesewa, some little dollar, or some little cedis to your cost. So you have the right to know your mode of payments, hospital charges, and any other expenses you had or you'll be having explained to you prior to your treatment. So you can either want to accept the health care or decline. But however, in the case of emergency, that should not be a blockade. You treated and then you later pay for the services. I know you have national health insurance and other insurance companies that actually will pay for the costs, and they will. So for that one, it will not be a problem. Yours is to receive health care. Know that healthcare is very expensive. However, your cost of healthcare should not be a blockage to you receiving better and quality healthcare. So I believe you got all the steps. RESPECT. If you got it, kindly drop it in the comment section, that respect. And then I want us to change the dynamics more. So now, anytime you walk into and out of the doors of the hospital, I believe anyone you meet, just tell the person respect. Instead of saying good morning, for you to remember, your rights, just say respect. Nurse, respect. Doctor, respect, instead of saying good morning. And I hope you do it, right? So I respect and I respect you, okay? If you enjoyed this video, don't forget as usual to like it, comment, hit the notification bell to always get updated anytime we post our amazing content, and also share it to your loved ones and friends. Our rights will not be infringed upon anytime we visit the health care. Until then, see you.